Listen to this insightful discussion between Women's Health Medical Advisor Dr. Maura Quinlan and Erica Austin in observance of Breast Cancer Awareness Month.
So, Erica, thanks so much for coming. So before we get started, I'm Maura Quinlan. I'm an OBGYN, long in practice in Chicago. I'm the Women's Health Medical Advisor for IDPH, and just here to get your story that we can share and teach some other women in Illinois. So if you wouldn't mind introducing you.
Thank you for having me. I am Erica Austin. I work at SIU School of Medicine as a Deputy Director in the Office of External Relations, as well as the Behavioral Health Workforce Center. I'm also the first Vice President on the District 186 School Board. I wear lots of different hats.
Yeah, you've got, and the diagnosis,
yes,
on top of everything else.
Yes.
Can you tell us just sort of the beginning of your breast cancer story, maybe your family history and screening, how the diagnosis was made for you?
So breast cancer is very prevalent in my family, or cancer in general is very prevalent in my family. So I have a great uncle who had breast cancer. I have two maternal aunts who had breast cancer, and I have two maternal cousins who have breast cancer, and my mother has cervical cancer. At the age of 23, I came back home from school when I graduated and getting regular physicals and checkups, and I had a doctor who asked me, hey, do you do self-examinations? And at that time, I was like 23, so no, I didn't do that, So she actually did a breast examination and found a lump.
At 23?
At 23 years old. 23 years old. That was benign, but I still kept, regular checkups. At the age of 28, I decided to do the genetic testing, the BRCA test.
So we wanted to talk about your treatment. Can you tell us about the diagnosis and what treatment what you were offered and what you decided to do?
Okay, so going in, I had an appointment with the breast cancer plastic surgeon, and I had already done my research, so I knew I wanted a lumpectomy because of my age, and I just didn't feel comfortable with getting a mastectomy right now. So I knew I wanted a lumpectomy. But then the doctor asked me, what about having a breast reduction, which is also a preventative measure, and we can use that as a middle ground. And so I really didn't hesitate. I was like, yes, let's do it for the first options. And I say that to say 7 out of 10 people do not know that they have that breast reconstruction is an option for them when they're diagnosed, but it certainly is. If this ever happens to you, just know that that is an option for you. It is covered by your insurance. They will cover that. And just to know all your options, do your research, know your options.
So you had that discussion before you had any procedure, and so you chose to have surgery, the breast cancer lumpectomy from that side and a reduction
on both sides.
Yes. So you could have chosen, they gave you all those options to go out. Instead of 2 surgeries, you had it just all at one time.
I had all at one time.
And what's the recovery like?
I am currently in radiation, so I have to do 20 sessions of radiation. So I go Monday through Friday, so every day, except the weekends, to get radiation. Radiation is actually very, very quick. It's like less than 10 minutes when you go in. The original plan was for me just to get radiation, but when you have surgery, breast cancer surgery, they take a piece of the cancer, they send it off to a lab, then the lab sends it back and they score it based off, a national chart. Well, my labs came back a little higher than what they expected, and so this is where technology comes in, and we have to appreciate technology and clinical research. Because of clinical research and technology, I was able to take injections instead of chemotherapy, because had that not been there, my next option would have been chemotherapy. But now I'm taking injections once a month for 5 years, and I have to take a pill every day for 5 years. And so that's my process of recovery has been radiation every day. I had my first injection, but I have not started the pills yet. But that's my plan.
That's for the 5 years. What does radiation feel like after? Does it hurt at the time, or any symptoms you feel after it's over, that later that day?
You're very fatigued. Very fatigued. I call myself the Energizer Bunny because I do so much, but I have to pull back because my body is still in recovery from surgery, number one, but also added to radiation. I'm also often very tired, just very tired.
Yeah, understandable. We were talking before this started about social media and how sharing your story, how you've done that and how helpful that might have been.
I have shared my story through social media platforms, and I actually had the opportunity to go to New York Fashion Week to model for a designer named Dana. And so she has a line called Anna Ono, and her line is to make women feel beautiful. So she has a line for breast cancer survivors and patients because herself, she's a breast cancer survivor. And so she makes lingerie for women to be proud of who they are, even in this diagnosis. And so I had the opportunity, sponsored by SIU School of Medicine, to go to New York and to model in New York Fashion Week. And so that has been like my platform. Ever since then, I've been advocating, telling people to go get mammograms, go get checked out, and even educating them about breast cancer awareness, breast cancer reconstruction.
Yeah.
So, yes, my platform is just to go because early detection does save lives.
Yeah. So can you talk a little bit about what it's been like as a breast cancer survivor now that you're sort of mid-treatment or getting past the time that you were diagnosed, and maybe the social media ways that you've been sharing your story?
Actually, I know this might sound weird to a lot of people, but it's probably one of the best things that ever happened to me. I have grown a lot during this process. I have been educated and made aware of a lot of things. I have met a whole realm of different people who we have built a sisterhood because we're all dealing with the same thing. But also I have found myself doing all this because I never would have thought I'd be the one out here advocating and spreading awareness. But I'm able to help save a life, essentially, by telling my story. And so I was granted the opportunity to go to New York to model in New York Fashion Week. I have a documentary coming out next week on October the 18th for Broad Day, which is Breast Reconstruction Awareness Day.
Tell us more about the documentary. It's sort of telling your story, your journey?
So the documentary actually documents my story and my journey from when I was first diagnosed to where I am now. Reviewing the documentary, seeing where I was then at, just 3 months ago, scared individuals to now, even watching myself blossom into this person who's like, hey, I'm here, I own it. I didn't ask for it. I didn't ask for cancer. I didn't wake up and say, hey, I want to get cancer today, but I got it, but I'm owning it. I'm owning it, and I'm making the best of it. I often say there's a rainbow after every storm. But when I was in New York, I realized that I was the rainbow. I'm the rainbow in that storm. And so, you have to look at it in that mindset because mindset plays a big part in this. And so I'm choosing to have a positive mindset, but I'm also choosing to live. A lot of times people get diagnoses and, they think it's a death sentence or they think it's the end of the world. It's not. It's all about what you make of it. And so Erica is choosing to live and be the rainbow.
Yeah, beautiful. I love that imagery. It's beautiful. So what kind of message are you trying to share?
I'm trying to share that if you know your body better than anyone else, advocate for yourself. Advocate for yourself. Get checked out. I want to destigmatize this whole notion of, well, I didn't feel anything, so nothing's there. I didn't feel nothing either, and something was there. So you don't have to feel anything for something to be destroying your body, potentially. So take action. Don't be scared. Yes, it's a scary feeling, but there is a light at the end of the tunnel, but you have to get through it. And so know your body, get checked out, and if you do have it, own it. Make the best of it. And just know your options. Know your options. Know what's available out there for you, and know your family history. The biggest message is that early detection truly does save lives. So, I know it sounds cliche, but it is definitely true. Had I not been consistent in getting my MRI done, mammograms, ultrasounds done, who knows where I would have been. For me, they call it at stage 1, but consistency plays a big role in that.
So what about people who say, well, I don't have a family history like yours. I don't want to get a mammogram. It's supposed to be, my friends say it's painful.
Breast cancer has no name, no face, no age, no race, no pace. Doesn't really matter if you have a family history or not. Go get checked out. And it sounds crazy, but it's better safe to be safe than sorry. You have more pain if you wait later and, something happens. Everybody's journey is different, right? Everybody's journey is different. But I'd rather you have pain and get in treatment than have pain and not get treatment. So mammograms do not hurt. It's more so pressure. It is not. It is not painful. It is not hurt, and it literally takes less than 10 minutes to get a mammogram, and you're done.
Right.
So get checked out. For Illinois, is 40 years. They recommend 40 years to get a mammogram. I'm saying if you could get it earlier, 21 even, get it done. You know, I know they say you gotta have a family history, but advocate for yourself.
Right.
Advocate for yourself.
Yeah.
You pay insurance. Advocate for yourself and get that done.
And telling your doctor about your family, your risk factors, and what's the best timing. Yeah.
Yes.
That is so helpful. Thank you so much for sharing your story.
No problem.
For information on complimentary mammograms, breast exams, and Pap tests for qualified individuals, please contact the Women's Health Line at 888-522-1282. That's 888-522-1282.